So I'm Allison. Myself, along with Malik, are the two co-chairs for CORA this year. And so this is a little Zoom chat that we set up to help talk about post-residency, how to find a job when you finish residency, how to set up that process. We can go to the next slide. So I'll introduce our speakers, go through a little bit of their story, get started on some questions. We ask that everyone keep their mic muted, and you can raise your virtual hand if you have a question or write your question in the chat. And we'll just try and get through as many as we can during this session. So we can go to the next slide. The next one, Rebecca.
Sorry, I'm just having issues. It's not advancing. Oh, there we go.
Perfect. So unfortunately, Dr. Gee couldn't be with us this evening. Something came up last minute. But we have Dr. Ayeni, who is president-elect of the COA, currently works at McMaster University and is a Canada Research Chair in Joint Preservation. He did his residency at McMaster and then did sports fellowships at the University of Ottawa, as well as Cornell Medical Center in New York. And then also completed visiting fellowships in Zurich, Switzerland, and Munich, Germany. And then we also have Dr. Dulai is with us, who's the second president-elect for COA, and is a pediatric orthopedic surgeon at Straley Children's Hospital in Edmonton, and is current president of the Canadian Pediatric Orthopedics Group. She completed fellowships in Sydney, Australia, and BC Children's Hospital, as well as a master's degree in clinical epidemiology from UBC. So thank you both so much for taking the time to chat with us. Maybe we can just start out with each of you kind of a brief talk about how you got into orthopedics, and then more specifically kind of what your first staff position was and how that came about. Dr. Ayeni, maybe we can start with you.
Yeah, sure. I'm happy to discuss that, and it's good to see everybody out there. And unfortunately, I also have to have a secondary talk with medical students at 8:40 or so about their career journey and whatnot. So seems like it's very topical. But in brief, orthopedics has always, resonated. I tell the story to my trainees that initially my first intention was to be an archaeologist. And so I was an undergrad at Western. We were going through a lot of that work, and it came down to applying to grad school. And my professor said, hey, listen, if you want to be a Canadian archaeologist, the weather doesn't really support that. You have to consider leaving the country and moving to a warm climate in Africa or the Middle East or, South America. So I thought, wow, that's too early to move away from family and friends. And then he told me, consider studying the bones of the living. And that's when I flipped 180 and went on the medical side of understanding osteology and bone health and everything else. And then went from Western to Ottawa, and then from Ottawa to the training at Mac and whatnot. So orthopedics as a medical student to me was great because you saw patients from the very, very young as in newborns all the way till people in their 80s and 90s and in between. Variety and technology was exploding with PRP and biologics, and you could do big trials with the mentors like Mo Bandari around in McMaster. So the combination of having this breadth of patients you could impact positively, the technology that was exploding at that point in time, the potential for research just really made it a tremendous opportunity to do these things. So I felt that it had the best combination surgically of doing research, of making patients better, and of course, doing what you truly enjoyed. And playing sports over the years, it also did resonate with being able to diagnose and treat people. So the combination of all those things, and my professor telling me, listen, move on to studying the bones of the living, really spurred me on to orthopedics. So, and I have no regrets since choosing orthopedics in my career. It's Sukhdeep there, Dr. Dulai, for her orthopedic journey in brief.
That sounded very well thought out compared to what I'm about to say. I don't think I chose orthopedics. I think orthopedics chose me. It was one of those things that I thought I wanted to wanted to do something where I could make an immediate effect on people, and I tried a few different things. I thought don't want to be a surgeon. I tried orthopedics, tried pediatric orthopedics, and I knew just sometimes you just know in life that that's where you belong, and that's how it was for me. I knew that that's what I needed to do, because I could make a big difference, and it was so interesting to me and so exciting, and you know, it was just something I was excited to do every single day. And that was, as a medical student, I was lucky enough to work with a couple of pediatric orthopedic surgeons. I did definitely tried a lot of different things, and I did the same. I tried to keep an open mind even during my orthopedic residency, which is one of the things I would say to you all, you know, because you know, if you just close your mind to one particular thing, you won't be sure in the end that you chose the right thing. And so I definitely tried a breadth of different things in medical school, thinking maybe something else, you know, maybe it was just the kids that I liked. So I tried PICU, or maybe I liked interventional stuff. So I tried cardiology, you know, maybe it was making a big effect on people's lives. So I tried oncology. But in the end, you know, you just know when it's the fit is right for you. And that, I think you'll realize that too when you're looking for a job. You know, since that's the theme of this chat, is that, you know, there will come something that feels right. And I'm a big believer in the gut and that feeling. And I would say that to you, you know, if the people feel like people that you know, want to work with for a long time, that goes a long way. So that's how I ended up in orthopedics, and pediatric orthopedics in particular.
Would you each be able to kind of discuss what your first staff position was and how the timing of that job came about, if you had discussions about it during residency, or did that kind of determine what your fellowship was going to be in, and the timing of organizing a job and then starting it?
Yeah, great question. I think, you know, it's always in the ideal situation, you have a job and you have an interest and it's a perfect match. The reality is, there's a little bit of wiggle room you have to have in flexibility to get that position you want. So, you know, going through residency as a third year, people identified me as having some potential. And so what I did was I asked the chair, what do you need at McMaster? What should I bring back? What skills do you think I could bring to the table that'd be useful clinically and maybe even academically? And then I looked at my interests and I said, okay, well, potentially these two areas are areas I'd like to focus on. And I tried to see, you know, can I move in one direction towards what they want? And also, can they move to what I wanted? And slowly found that, you know, opportunity to have it really align very well. So I think you have to be flexible as you get into your third and fourth year, have those conversations with your attendings, and then look at the demographics of your program, right? So you know that there's usually, you know, some retirements coming up and who may be interested in, you know, potentially job sharing or transitioning somebody in or out. And those are very good opportunities to have those conversations as well. So, you know, as you get into your senior years, have a conversation with your chair. Where are you looking at? What can I bring? Do you see me as a potential colleague? And then look at where the needs are in your program locally. And, you know, somebody once told me is, yeah, whatever people don't want to do in your specialty is where maybe the original opportunities exist. And at that time, people used to say things like, well, you know, we see these young patients with hip problems, but we don't know what to do. We can't offer them a hip replacement. So I don't know, there may be a scope available. So I recognize that that was a bit of a, you know, a gap in what we could offer. And so that's why I trended and, you know, really volunteered to study that more intensively and then bring that back. So look at where there are question marks or frustration points and problems people want to get solved in your program or elsewhere in the community around you. And then you can sort of find out if you can fit and then what you could negotiate to make it really work out well for both your community and yourself.
Yeah, so I definitely did not know where I was going to be practicing when I finished residency. And that was a very deliberate decision by me, because I knew I was going to be doing 2 fellowships and a master's after I finished. And I all I wanted to do was get away from residency. I don't know if any of you had that feeling, if you're late in your residency and you're like, I'm ready to not be a resident anymore, you know? And I needed that space to figure out where I was going to be. I knew I was going to be a pediatric orthopedic surgeon. So that's one thing I would say is I totally agree with Femi's remark about, you know, some flexibility. you can, you can say, I really need to stay in X place for whatever reason, because of family reasons or whatever it is. And if that's what the main priority is, then you have to work with what that place might need, right? In terms of specialty, in terms of what your practice content's going to be, what it's going to look like. Or you can say, I really am going to be, a hand surgeon or a pediatric or surgeon, but I'm going to be flexible on where I end up or what type of practice I have. If you have no flexibility, if you say, I want to be this, I want to have this, I want to be a fifth toe surgeon in Toronto, then you might have a problem, right? Finding a job. Unless they need a fifth toe surgeon at the exact time you graduate in Toronto, and they like you, right? They think that you'll be a good fit with their group, which you want as well. You want colleagues that you can call on in your hard times, or times when you need somebody to back you up, or you need personal time or anything else like that. And they want the same, because that makes a good, work environment in the long term. But going back, so I didn't know where I was going to practice. I completed my first fellowship, and I was in Australia, which is not a great place to look for a job in Canada from. But luckily I knew I was going to be coming back to Canada because I was doing a master's. And so I was in Vancouver for 2 years, and that gave me plenty of time then to put out feelers. And to be honest, initially I did not think I'm from Edmonton. I ended up back in Edmonton. I didn't think I was going to be, but for family reasons, just had a family member who became ill, and so I ended up coming back here. And to be honest, it was the most perfect thing that could have happened to me. So, but that was where I was open. I was open to the idea of where would I work, so that I left lots of options open, rather than saying, I want to be a pediatric orthopedic surgeon and I have to work in X place. So that's one of the things I try and always impart to residents is, you have to figure out what's the thing you can be flexible on and what can't you be flexible on. And then you have to work with the flexibility in the area that you can be.
Thank you. Maybe for the next question, let's talk about the pros and cons of an academic practice versus a community practice, and then we'll take a question from the chat.
Excellent question. It's a different answer for every individual. So that's the first thing, right? So, I took some time to really understand what a community practice was like. So I went out to a community center for 3 months. And what I saw was an impressive array of skills by one surgeon who, the list we did had one day was a carpal tunnel, followed by a total knee replacement, followed by a rotator cuff mini open, followed by, I think, a knee arthroscopy, and then followed by a bunion. And so, that breadth and skill, even though communities are now specializing, as they get into bigger groups, but back then I thought, okay, this is something or someone who has covered, several subspecialties in one go. At the same time, I felt that, with my academic interest that was just beginning at that point, I really wanted to try and home in on one or two things I could really be good at, and then focus on that and ask the important questions, and then, try and contribute to my field in those couple of areas. So when I went to the academic side of things and then worked with the academic surgeons and saw that they had the expertise that was fixed in one or two areas that they were really, really sort of renowned at, I liked that model because that was a better fit for me to be good at a couple of things and focus on those, as opposed to having more of a breadth of practice and seeing everything, from, the fingertips all the way to the toes, as Sukhdeep mentioned earlier on. So I think that getting that experience to see what is a community practice like, what is an academic practice like, will you be bored focusing on one or two problems, which is also a real potential as well, or will you actually be sort of more interested in drilling down and really, mastering that one or two critical areas of your field? So it's a different answer for everybody. But I think that for me, that exposure to both practices was very instrumental in guiding me what direction I decided to go in.
Yeah, so That's interesting. You know, I mean, I have an academic practice, but as a pediatric orthopedic surgeon, we get a lot of breadth, you know. So I'm treating the arms and legs, that, you know, there's a lot of breadth. So I guess it depends on the type of academic practice you have, but I do agree that a lot are, like Femi said. I started residency thinking I did not want to do any fellowships. I did not want to do research. I wanted to do my 5-year residency and get out and operate. And I now, you know, I'm in an academic institution where I'm a research director, a fellowship director, you know, and so it changes, right? Things change. But the thing is that part of it is, you know, what kind of practice do you want? Like Femi said, if you want to do general orthopedics, now the current environment in Canada has really become quite subspecialized in academic centers. So if you want to do general orthopedics in general, you're going to be working in a non-academic center. So so part of it is, you know, if that's your interest, then that's what you're going to be thinking. The advantage of doing an academic practice is, one, you know, you're part of a group of people who are constantly pushing the, you know, current limits of knowledge. You're always thinking about what's new, what could be done better. You get the chance to try the latest and greatest first before other people in the community to do, because it's part of research. You get to see a lot of the more unusual things because they get referred to you because they can't be dealt with, you know, by generalists or by, you know, people doing less or with less expertise in your particular area of expertise. You know, it's an opportunity to interact with, you know, talking from a professional aspect, the people who are going to keep your profession going in the long term, right? So you get a chance to influence the next generation. I see that our past president, Laurie Hiemstra, has joined us, so perhaps we should invite her into this conversation as well.
Thanks, Suk. Hi, everyone. Sorry for being a little late.
Okay, thank you for joining us. We're just kind of talking on job opportunities, how to find a job after residency, that type of thing. Dr. Hiemstra was the past COA president and specializes in sports medicine and works out of Banff. There's a couple questions in the chat, so I'll start with one of those. This is from Reza. In the first 2 years of practice, what are your tips on balancing elements of an academic surgeon, polishing surgical techniques, teaching, research, and balancing that with family?
A great question, Reza. I think one tip I've used and I've also told trainees is have multiple mentors and a CEO of mentors as you're developing in life and in your career. So you don't try to have the same mentor who's your expert at research, answer questions about your family development, and then maybe even your technical abilities and which courses should go on. So try and not overburden your mentor, but recognize that you can get multiple, you know, areas of feedback from different individuals. So the attending who you really, you know, love the relationship they have with their family members, talk to that person and really get some good tips on how they've built that and have that sustained over time. Somebody who's very strong technically in your program and you want to mimic the expertise, go to that person and really just drill down on what they're doing to get better surgically. And somebody who's an expert researcher, have that person on your team as well, and ask that person about research and how they, you know, ascended up the craft and how they built their careers. So when you first start, you know, try and have 3 or 4 different individuals that you ask questions about this. And it's also bi-directional too. So meaning don't just be the one asking questions and not offering anything back. A lot of people who are mentoring you would like to know, you know, things about what you're up to as well. So don't make them into a crisis manager where they're only answering questions when you're in trouble. Try and make it into a relationship where you're actually offering help. Sometimes people struggle with PowerPoints and things like that who are potentially, you know, looking at different topics. So, you know, when I was a fellow, my you know, give back to my attendings were, hey, listen, Ayeni, I need a PowerPoint next week and I'd get it done. You know, so I was trying to help them as they were helping me with advice. So always, you know, look at these different areas in your life, recognize they're all very important, and try and find, I would advise you, a mentor for each segment that you think you need advice on, and don't burden one person with everything and all of your questions. Get as much feedback as possible.
Yeah, that's excellent advice, Femi. I'm going to take some of that myself. First thing I would say is do not think you're going to be perfect. Don't try and be perfect, in all those areas. That's you're just going to put undue pressure on yourself and an expectation you can never meet. One piece of advice one of my mentors gave me before I was starting was that, even if you're at an academic institution, the very first thing you have to do is, get yourself comfortable as a surgeon before you can start giving up cases to, learners. And that's okay. And you can teach without necessarily, and people can learn a lot without necessarily doing a case, right? If you feel like you need to do those tough cases, because you need to get to that comfort level, then that's okay. Because ultimately you're the one who's responsible for that patient, and you have to say that you delivered the best care you could to them. And so you can balance the education, teaching learners by providing, really good instruction that doesn't necessarily involve them actually cutting with the knife, and they can still learn a lot from that. Just like people can learn nothing and think that they did the entire case, right? Because you walked them through it, they had the knife in their hand, but in reality, they couldn't do it if you weren't there, right? And so I think realizing that there's more than one way to do that helps you to not feel like you're compromising, one, your experience and your patient's well-being, and two, your learners' well-being. I think that in an academic position, it's really important that when you start, you have a very good conversation with your chair regarding your balance of different responsibilities. So academic positions always come with a description of 4 things. It's your clinical commitment, your educational commitment, your research commitment, and your administrative commitment. And so how that gets split up is a division of your time, at least on paper, and making sure that that somewhat matches what you want to place your emphasis on. And the chair will often say, okay, what are the needs of the department or division, and and whether you fit well into that. And then how are you going to spend those hours doing those things, at least selecting things that you think are what you want to be doing and where you can have an impact. It's so easy to say yes to everything. And while I agree with Femi that you want to be helpful to people, it's also important to realize it's really hard to get rid of things once you've said yes. And so, at least in my experience, and Laurie and Femi can disagree with me if they do, but so at the beginning you'll tend to say yes because you have the time and you're young and you have lots of energy, but also think thoughtfully about, are these things that, one, you can make a difference in, and two, that you're passionate about, and three, that there's a need for, right? And I think that's how I kind of characterize what am willing to put my time and energy into these days. And I think, if you try and do that from the beginning, then you have that time for your family, or you have that time to do the other things that are important. But there's no, I read something somewhere that no one has the perfect balance of everything at every time. It's a matter of shifting the balance to where your time is needed the most in different times of your life. And that's where you have to kind of be aware of that and be in an environment where you're able to do that. I think so.
Yeah, those are really great points. I have to fill in some gaps now. What I would say is, you have to do what you're passionate about. So just because you want to do research and you want to teach does not actually mean you have to be at an academic institution. So I work in the community and I have a very large research program, and I teach fellows and residents. So keep your vision broad, and you can, it's okay to not like one of those things. Like, there are some people that hate research, and it's actually okay to hate research. And probably the worst thing you could do, or maybe you hate teaching residents because you really need to have control. I think the worst thing you can do is force yourself into a job where you're doing something you hate and that gives you anxiety or makes you angry. So there's lots of opportunities, both academic and non-academic, where you can really fulfill some or all of those things, but maybe have a little bit of avoidance for some that might not float your boat. And maybe I'll just add to Sue, it's okay to say no. I think when you're starting practice, it's like, and you probably have this, you guys already have this as residents, right? You know, staff person asks you to write a paper, asks you to do something, you always say yes, you always say yes, you always say yes. And you feel like you have to say yes to everything because you've got to be the best, right? To get the job and get the fellowship. But I think to say no, you have to learn to say no at some point because no one can do it all. And if you learn to say no to the things that you're not passionate about, it'll serve you well in the future. And the reality is we rarely do a really good job about things we're not passionate about. And you do a really good job about things you love about things you love. So if you need to write a paper about something, like if you ask me to write an arthroplasty paper, it will suck, right? But if you ask me to write about patella, it's going to be a great paper. So you also don't want to say yes to a bunch of things you don't like and then do a poor job at it. So I think really stick to what you're passionate about, and that will show through in your work, and it'll show through in how you are able to balance all these things. And it's like soup. I hate the word balance because it's not work-life balance. It's how you integrate the two. And there is a season for everything. Sometimes it's a season to, you know, bust and move. And sometimes it's a season to say, you know what, I have enough on my plate right now. And I really just need to say no a little bit. And these things will all come around. It doesn't mean you're going to say no in 6 months, but you might need to now.
It's all really great advice. There's a question in the chat from Kristen Barton. So how did you negotiate your contract and salary? Any guidance on items included in your contract? So the teaching services, protected research time, that type of thing. And I guess to go along with that, how do you start having that conversation where you've spoken to the chair about maybe where there's a gap or a need in your program that you're trying to fill, but convert that to a contract and not just a continued discussion?
Yeah, maybe I'll start a bit because I'm leaving in about 5 minutes. In brief, I think you know, most programs now are receptive to the idea of protected research time. I'm sure Laurie, myself, and Sukhdeep have done a lot of evenings and weekends starting out when we were doing research where it was, you know, perceived to be something that's more, you know, a personal interest, but there's recognition that it does help grow a program. I think overall, you know, if you have a coherent plan that you're presenting to your chair, that this is what you want to do academically, that makes a big difference, as opposed to saying generically you want to do research. Like, what is your plan and what is your deliverables in 3 to 5 years? So if I'm looking at it at Mac, I'd say, hey, that's great. We can find some protected time and even fund you. But then at year 5, I'm expecting some deliverables, right? So I think that's the important part is, you know, apart from saying what are the protected mechanisms or that are put in place, is also what are you going to deliver afterwards? And which will put a little bit of pressure on yourself early in your career to deliver a CIHR grant or multiple, you know, high-level peer-reviewed papers. So I think in the world of academia, increasingly, it is a back and forth as to, yes, here's some funding potentially, usually not enough to replace clinical income at this stage, because doing a day of clinic or a day of surgery usually can compensate you more than a day of research. So everybody understands that, and hopefully it will change in the future. But then also when you present your plan, also have in the back end of your plan, this is what I will bring to your program: podium presentations, a national presence. You know, we want to have publications at these journals. We want to have a grant in this. So just sort of put together a coherent plan that makes sense, that looks like it's building upon, you know, step after step, and it's vertically oriented. So that's what I mean. Vertical oriented means, you know, you have a program that you say, hey, like Laurie Hiemstra has built a great career on patellofemoral instability, but she started off with surveys, then systematic reviews, then a randomized trial, then a patella score. So she's building on concepts that made her an international leader, and Sukhdeep the same. But sometimes when you first start in your research, you know, career, you start doing multiple different things, and then you don't tend to grow vertically. And then when you come to that year 5, you're getting reviewed, your chair's like, well, we did protect you and give you this income and money and whatnot, but we don't see that ascension in your career and in your direction. So really try and put together a program that's growing vertically, and also one that has some deliverables that are concrete. And then when you do have that protected time, you use it wisely.
Yeah, thanks, Femi. This is a really hard question to answer, actually, because you know, in terms of negotiating contract or salary, it is done differently at every center. You know, there are places where If you're in the community, generally it's about, getting hospital privileges, and you will be on a fee for service in many provinces. I think in most provinces, if you're in the community, you're on a fee for service. So that's different than if you're at an academic center. And then even at academic centers, some places are on alternate payment relationships where they have a given amount of funding to deliver that service. And that department will say, okay, we're going to divide this amongst members of the department. How they do that can vary. Sometimes it's by seniority, sometimes it's by the nature of what you're doing in your job. Sometimes it's by, sometimes it's even across the board, although I don't really know of any that are even across the board, but there might be. And in other places, there are people that get hired on either a clinical stream or an academic stream. And so those will vary. Even though would be on a clinical stream with that academic center, you wouldn't necessarily be getting a salary. So that would be those negotiations then are more along the lines of saying, what am I bringing to the table? That's number one, so you have to say to them, I'm bringing something to the table that you guys need, and that's that's why they would hire you. And on the reverse end, what is that worth, right? And so if you're on a clinical contract, then really your earnings will be determined by your clinical activity, because that's usually fee for service, unless you're in a place where you're on an ARP. And then if there's an ARP, alternate relationship plan, then that will dictate what you have to do, actually, because those are already set out in ARPs. Is some of them will have deliverables in terms of, you have to spend X number of days doing this type of activity, like clinical activity, or you have to see so many patients a year, or you have to perform so many surgeries, or it depends on the place that you're at. And so that's worth maybe doing some research if you're looking at a particular place, talking to some people to say, hey, what is the fee structure in this place, for an academic or a clinical person? If it's an academic contract, and that also varies. So again, there are places that are on an academic ARP. And so in those places, it's already set that, you would get a certain amount of payment to deliver certain services. And so, if you had X number of clinical days or X number of academic days, then they add up to they all have a point equivalent, and then they'll add up to a 1.0, which would be set at a X number of dollars for that place. And so, and that can vary with if you're starting versus if you're a senior person. So they may have a scale that over time, the longer you're there, the more you can earn at a 1.0. But if you said, you know what, I don't want to work 1.0, I want to work 0.8, then you would get a 0.8 of that ARP if they accepted that. And what is that 0.8 made up of would depend on what they get points for, right? So it's a point system. And then you would say, okay, they would say, this is what we want. And, you could negotiate that part. If you said, I'm a hardcore researcher and I want to spend half my time doing research, which most academic places love, especially if they do have an AARP, then you can do that. Other places there's a salary for it, or it's a mixed system where you get a salary from the university for your academic portion of your position, but you're also expected to bill for your clinical activity on top of it. Just because a university salary is never going to be anywhere close to what an orthopedic surgeon could earn if they were full-time clinical. But one thing you have to understand is that in general, and this is a very general statement, Laurie, correct me if you think I'm off base in this, but in my experience, anybody who takes on an academic career, you're agreeing to take a pay cut relative to someone who is full-time clinical. Because, academic hours are just never going to be compensated, at least in current structures. And as Femi alluded to, people are trying to change it, but are rarely, I should say never, but are rarely compensated equivalent to clinical hours. And so part of being an academic is knowing, what, I'm passionate about academics, and or it allows me to do the kind of work I want to do. So I'm willing to do that. Does that answer the question?
Yeah.
Laurie, do you want to add anything to that?
Yeah, no, I think that's great, Suk. Maybe I'll just give a little a more community-based perspective. But you know, to me, there's four things we do, right? We do clinical, we educate residents and fellows, we do leadership, and we do research. And really, orthopedics can't run without any of those. I'm going to get on my soapbox here. They're all necessary, but yet our society only pays the clinical for the most part. Like you might get a little research position, but like it's nothing what you would make if you were working. So it can become a problem in the community too. So, and really the problem is when you have greedy surgeons, right? So I do not work in a greedy surgeon place. And my best advice for the community practice is work with people that you respect and like, and communicate well with them. So, you know, we have 4 surgeons, and like it clearly that's how you make money, right? So you make money by not having residents, not having fellows, not doing any research, and operating your butt off, right? You will make the most money. If that's all you care about, that's what you should do. But really, clinics don't run like that, and our profession doesn't run like that. And that's, I hope, how most surgeons don't feel about our specialty. So I think what works best when you have a small group is that communication. So everyone has their strengths and their loves. So I'll just give BAMP for an example. We have 4 surgeons, and I love research. So I do all that research work that's unpaid. And then my partner, Michaela, she takes care of the fellows and residents, and she sort of does the education piece. And we all have our roles. Someone else is doing the administrative piece. So I think if you really communicate well with your partners, and you can sort of establish those roles where you're all sort of equally doing the unpaid work, which I hope someday all should be paid work, because it really doesn't make sense that we only pay clinical, because we can't run without the rest of them. So, but I think that communication and really being honest with people, like, you know, I think there's room for, you know, certain people doing clinics during the day and other people maybe doing evening clinics because they have family commitments. And like all these things work if you think outside the box and communicate well with each other. And I think that would be my biggest advice if you're going to go to a smaller center, is really try to establish with a mutual respect and communication. And it tends to work out quite well if you can do that. But people will get bitter when there's someone not pulling their weight, because there is a lot of unpaid work you do. You know, if you're in the university, it sort of is all those meetings and all that academic stuff you do, but there's a lot of unpaid work in the community also, unless you're not getting residents and fellows and not doing research and just, you know, operating.
Yeah, I think if I could add just one thing, you know, like I just can get on my soapbox now, okay, for a second. I'm gonna say one thing to remember when, you know, you're in residency and you're like, you know, maybe in debt, or, you know, you're waiting to actually make some money. Just remember that money doesn't equal happiness. In the long run, you will always, as an orthopedic surgeon, earn much more than the average person and much more than you need to be happy. So in the short run, it doesn't seem like that when you're paying off residency debt and all the rest. But the decisions you'll make about your career will be for the long run. And remember, your first job doesn't always have to be your last job. That was probably the best advice someone gave me, right? When I was really stressed about which job I should take as my first job. I was lucky enough to have several job offers, you know, but if you take it that way, it's an easier decision to make. So
We'll take another question from the chat. This one's from Laura Morrison. What do you see as deliverables to offer for education/leadership? Does involvement in the residency program, the department, or the COA have the same value, if you will, as abstracts, publications, and presentations?
yeah, so if you're in an academic center, when you're talking about deliverables that they're interested in, I mean, there are traditional metrics, as you mentioned, Laura, about, you know, publications and presentations that have obvious value to the faculty evaluation committees when they're looking at, you know, did you deliver what you are supposed to each year? But fortunately, you know, the universities are also interested in things that can raise their profile nationally and internationally, and that bring obviously anything that brings dollars to the university. So if you're getting research grants or things like that, they're obviously interested in that. Contributions where you take their name and you put it on the national or global stage. So actually there was one error that you made earlier, Allison. I'm not the current president of the Canadian Pediatric Orthopedic Society. I was one of the founding members, and I am the past president. But that's a perfect example. I got paid nothing to help found that organization, or put in a ton of work to get that off the ground. And it's now a very successful organization. But fortunately, because it did lead to national and international recognition, the University of Alberta, where I'm at, recognized that as a significant contribution. So I think the things that they will, they're interested in knowing are things that meet their vision, or interested in you saying you can deliver. So if you can, take whatever university you're at and bring their name and have it highlighted at any kind of national or especially international venue as you get more senior, then that's something that they will take of interest, right? Or if you're bringing any kind of dollars to their center, or you're doing something very unique that they can then leverage, right? To say, we're the first place that did XYZ, right? Or we're the best in the country for whatever. So for sure there are different things, but that's one thing you need to talk to your chair about, and make sure that they see the value in that. And because in most faculty evaluation committees, meetings, the chair is the one who would represent you to say, this is the work that this person in my department did this year, and this is what I value. These things are highly valued, right? So it's good to be for them to be on the same page as you. And the other thing I should say, Laurie, you and we're both from Alberta, so some of these comments might vary, like I was going to say there are places that do pay researchers equivalently, but there's not many of them, right? And they have to be on an ARP to do that, because no other place can do that. And there are very, very few places. So some of our comments might be a little biased geographically. So
100%. Yeah. No, those are really good points. And I'm just going to keep giving the rural perspective, because I actually I have a university title, but I don't work at the university. But I go back to, you have to do what you're passionate about. So my CV, it gets me lots, but it gets me nothing for the university. In fact, I think I give the university far more. I get nothing. So I clearly give them more than I get. But you want to be strategic in these deliverables, and what you publish, and all these things that look good on a CV. But the reality is, I would argue most very successful people will tell you that the things that they got the most mileage out of were things that they never thought they would. So just like Sukh's CPOG, and I have founding member of IOTA, founding member of Women in Orthopedics. When I took those on, it was oh my goodness, I got another thing on my plate, but I'm super passionate about it and I'm going to do it. And look what happened. When you do things you're passionate about and you believe in, you might not see the benefit of it, but down the road in your career, wow, I'm so glad I did that, because it actually did get me something, not in that bad way, but when you work towards your passions and what you love, good things come from it, versus just doing things because it's going to look good on your CV. So I think that shines through. So I'm just filling in blanks because Sukh's answering these questions so well.
Really important things to keep in mind. Another question we have is, if say you're finishing up your first fellowship and don't have any job opportunities at that time, what do you think kind of the pros and cons or thought process is behind doing a second fellowship versus locuming, and kind of the experiences you would get from?
That's an excellent and very tricky question, actually, isn't it? I mean, I have seen people do both, and both be successful and both be unsuccessful, depending on the person and the choices. I think it's important. I mean, listen, I don't know of a place personally that can guarantee you a job, 3-4 years down the line. So just because there's so many factors that can change in that time. However, I do strongly believe, that, you know, it's good to make good relationships. And if there are people that you trust that can say, yeah, you know what, we are going to be looking for somebody in this area around that time, you know, and you have a good working relationship with them, and that's a real possibility, right? However, if no one's willing to say that to you, then you also need to see that for what it is, right? To say, okay, that job doesn't exist. How hard am I going to fight to create a job that doesn't look like it's going to exist, right? But what was the question? Oh, yes, fellowships versus locum. Sorry, I got off a little bit of a tangent there because I'm not sure how to answer that. I guess it depends on the locum opportunity and the fellowship opportunity. You know, doing another fellowship for the sake of doing another fellowship, or just burning another year is dicey, because I've seen people do 2-3 fellowships, and then basically they weren't really related to each other, or they didn't help them to make them a better candidate, and so it didn't really help them get a job. So if that's what you're doing, then that's probably not the best idea, I would say, at least in my opinion. I think if you're doing another fellowship because you think, yeah, that's going to add to your add to your expertise in the area in which you want to get a job, or because somebody has said, hey, listen, you have this, but we really also need this. Do you think you can go away and get this training? Then that makes sense. Go do another fellowship in that area, right? Because they've said that to you, and that there's a good chance that that'll lead to a job. So that's how I would say, in terms of doing a second fellowship, is if it's going to help you get the job you want, then by all means, right? I did 2 fellowships because I wanted to be an expert in particular things, and I knew I wanted to do my master's during my second fellowship. I didn't do two fellowships because I couldn't find a job. I didn't do 2 fellowships because, I didn't know what I wanted to do. So do fellowship should really be because it's to lead to a purpose of you getting training you want, or training that you need for the job that you're hoping to get, or that you want. In terms of a locum, and by the same token, if you do a locum when really a fellowship is what you need to get the job you want, you then take yourself out of the market, right? So if you do a locum that's directly related to the type of work you want to do, or working in a place where you want to work, and you haven't worked there before, so people don't know you, and you think, okay, this is going to help me, get known in that place, make some relationships, and that, oh, there's a job perhaps coming up in that area, then that might be really great. In the community, if you did a locum, I think it would probably help you get another community job. That I could definitely see. But from an academic center point of view, I would say my former comments. However, if you do a locum because you say, oh, well, there's no jobs right now, well, so that then becomes I think it reflects less well sometimes compared to somebody who has gone out and done the exact training that a center wants, and then come straight into the job. But that's not always true. That's not always true. If your locum experience relates directly to the job that you're looking for, then that could give you the leg up. So I guess it depends on what the purpose is that you're trying to fulfill. Does that make sense? Okay, Laurie, please step in and say something better
I
than
was
that.
just watching you hedge on that one so much. It was awesome. That is the hardest question in the world, because I think it really depends on where you're looking to work, and your personality, and the personality of the people where you want to work. So, I can think the scenario which Suk just wandered her way through, where both of those options could really help you, and both of them could really hurt you, right? So I don't know the answer to that. I think it really does depend on what you're trying to accomplish, which is exactly what Suk just said. So it's really tough. I think, in smaller centers, people are really concerned about the personality of who will join them, right? If you only have 2 or 3 surgeons in a spot, they want to be really sure your personality and your work ethic is a good fit. Then doing a locum with them, or doing a fellowship with them, is really, really important. You know, if you're in a big university center, the fit stuff might not matter as much because there's 40 surgeons or something, and then your training might matter a little more. So I think the answer is going to change depending on the person and the center where you want to go.
Yeah.
Makes
Tough.
sense. Yeah, it's kind of situation dependent.
Yeah.
We have a few more minutes left. There's no other questions in the chat, but I have another question. What would you guys suggest kind of thinking about in terms of pursuing a fellowship in North America, where the staff you work with would potentially know other staff in North America and be able to discuss kind of job opportunities and things like that with you versus pursuing an international fellowship?
Another good one.
Yeah.
You want
You,
to
you
go,
go first, Laurie.
So I think the answer is a bit the same. It depends who you are and what you're trying to accomplish. I think I personally think doing a fellowship somewhere else is better. So especially in a small center, we don't want the same thought processes that we taught you. We want you to go, I'd love people to go to Europe and stuff because we learn, right? So when you're in a small center and you're not doing rounds, you're not surrounded by all these surgeons, every resident that comes to us and every fellow that comes to us teaches us what's happening in the center that they trained in. So when Michaela went away to Pittsburgh, we learned everything that Freddie Fu and Volker Musel and everybody was doing in Pittsburgh, which is awesome for us to learn in Banff. So I think especially for a smaller center, we want to know who we're getting, but we also really wanted that new information and just the freshening up of what we do, and so we can learn also. That's my answer, Sue. You can fill in that one.
Yeah, I 100% stamp of approval on that answer, because, you know, when we hire someone new, we always think, what new can they bring, right? And if you have gone and trained somewhere that nobody else there has trained, then you're going to bring a different perspective and maybe some different skills. And by that, the whole group grows, right? You know, but you also want to make sure that the center you're going to has enough volume of whatever it is that you're going to do, or has a dedicated, you know, program of some repute, so that, you know, you don't go there and spend a year in some exotic place and then come back and be like, well, I don't have any confidence in doing this because I didn't really get the experience that was promised. So it is important to research those fellowships carefully. I mean, if you're going to do two, I mean, like I did, right? I did one internationally and one within Canada, both at places of repute, right? So being in Canada for my second helped me, you know, like do my job search during that time while I was more locally. But I will say it's hard to do interviews and things when you're on the other side of the planet. That gets a bit challenging sometimes, especially if there's places you're applying to that you have never worked and they'd like to meet you in person. But everything can be done, and especially in these days, you know, I mean, I'm not going to tell you how old I am, but I interviewed a long time ago, before the days of Zoom, you know, and so now many things can be done virtually, right? But obviously, face-to-face time can never be replaced by anything else. So I think really it's about finding a place that gives you the experience you want, and always, if you can get something, bring back something different, you now have something special that people will want.
Last question, kind of to touch on what you just spoke about, and Laura put this in the chat, but any advice for kind of staying in touch and staying relevant during that year that you're potentially in Australia or New Zealand or Europe, to kind of keep yourself in the front of people's minds for job opportunities back in Canada?
Yeah. Well, I'm personally the absolute worst person to give you advice on that. When I left for Australia, I said goodbye, and I didn't talk to anybody for a year, because I was like, I need to be just done with residency. Even though I had a very good residency, it's nothing against my residency. It was just I was ready not to be a resident. But that's not advice I would give anybody, actually. I would say, if you are interested, you know, before you leave, it's important, especially if you're wanting to go back to the place where you did your residency, or if you think someone where you did your residency is going to be able to help you get a job somewhere else, which is very likely, right? it is important to keep in touch, you know, whether that's just, you know, sending the odd email to let them know what you're up to, let them know your plans ahead of time before you leave, to say, hey, listen, you know, this is, you know, what, you know, talk to them about job prospects, to see what they have to say. If, you know, if you have a mentor who would suggest, you know, yeah, you should look at this place or that place, or I'll talk to this person, or I'll introduce you to this person or that, those things are worth, you know, making sure that you follow up on. Yeah, basically don't do what I did. Laurie?
Well, a couple things. No one's going to forget you in 1 year. So 1 year it may seem like a long time to you now, but it's a flash. As far as I understand it, most people have a job set up at least a year in advance. I think maybe not most, many people do, right? So, you know, you're going to be talking to people along the way. Not everybody does, but many do. So again, you're not going to lose those touch points. I think touch points come to the COA meeting. So I always meet up with everyone that's trained with me and stuff. I try to at COA meeting. If you have subspecialty meetings, you can meet up with the Canadians there. And what Suk said, do one fellowship in Canada and one away. But again, if you know where you want to work and you're already developing, you know, trying to work on your job, sort of as you go off to fellowship, because you've had those conversations about how your specialty fits in and everything else, you're going to stay in touch with people. And it's so easy these days. You're not writing a letter, right? So and posting it with a big Australia stamp on it. So you're going to be in touch, but I think it's actually really easy at meetings, because I see people at every meeting I go to and try to get together with them. So.
Well, I think that's the end of our time. Thank you so much for taking the time to speak with us. I think we all got a lot of valuable information out of this. I am going to plug the COA meeting. If you haven't registered yet, you can register at the COA website. We'd love to have everyone out here in Halifax. And with that, yeah, thank you everyone, and have a good night.
And the only thing we would say is that we would encourage any residents or fellows who aren't already members of the COA to definitely apply. It's super cheap, i.e. perhaps free, and it'll definitely pay off in the long run.